However, the bleeding resumes 5 minutes later. Most appropriate next step in management. 12-year-old boy brought to the ED by his mother due to a 20-minute history of spontaneous right nostril bleeding. No history of any medical conditions, no medications, denies trauma or nose picking. Vital signs are stable. After pinching the nostrils for 10 minutes, the bleeding stops. However, it resumes 5 minutes later. Next step in management. Ooh. I think we would start with, I don't know if we start with packing or cauterization. I think I would start with packing.
Okay, final answer.
Yeah.
Yep. As an ENT, I approve this message. Yeah. So it stopped, right? And then it started bleeding again, which, nosebleeds tend to happen. Actually, me personally, right? I mean, obviously, this is a test question, but in actuality, I'll tell them to hold pressure again for another 10 to 15 minutes with
Yeah.
Afrin, and that will usually stop it. But in this, right, the answer should be try compression again. The only one that will give compression is intranasal packing. A lot of the times it depends, perform cauterization of the bleeding site. That can mean a lot of things like silver nitrate, which is chemical cautery. It can mean going back to the OR to use electrocautery, right? But
Yeah.
for the most part, most nosebleeds, even bad ones, can be controlled by local pressure with medication, local pressure, things like that. So yeah, so I'm glad that they had this here, refer the patient to an otolaryngologist. Yeah, it's funny because there's so many things you can do prior without my expertise in particular, right? And so obviously if you've tried all the things, then of course, call an ENT to see if you need to go to the OR or something like that. But yeah, so good. Pressure is going to be best. IV fluid is not really necessary for nosebleeds unless you have a hemodynamic issue, right? A CBC can be helpful, right? If you are like, oh my gosh, I've tried everything and you finally got to stop and you're just like, this was way worse than it usually is, then you can run like a CBC and run through some bleeding disorder panels such as like von Willebrands or factors, things like that, right? Like factor 8 deficiency, factor 9 deficiency, and things like that. Perform cauterization, right, is an option, like I told you, but you want to wait, refer to an ENT, right? So obviously, if you've tried everything and everything in your power that is, and you need an expert, then of course that's kind of later on.